Hi, my name is Elshwa. I'm going to talk about eating disorders today. Eating disorders are disturbance in eating behavior that concerns your body image or size. According to DSM-4, there is two main eating disorders, which are anorexia nervosa and bulimia nervosa. Both of their symptoms overlapped and they are differentiated based on their person's body weight. Anorexia nervosa has two types. One is restrictive type and the other one is binge eating and purging type. In bulimia nervosa, you also have two types. One is non-purging and the other one is purging type. In terms of their etiology, there is a strong correlation with serotonin dysfunction in these patients. There is a high morbidity with obsessive compulsive disorder and body dysmorphic disorder. Regions that affect feeding behavior such as nucleus accumbens, orbitofrontal cortex and insula are also affected in these patients. Anorexia nervosa is diagnosed based on body weight, which it will fall below 85% of ideal body weight, and this weight loss must directly due to intention of losing weight and not any other biological dysfunction. The average diagnosis is made about 17 years to 40 years old. This is more common in high socioeconomic status and it's more common in dancers and models. In anorexia nervosa and also in bulimia nervosa, they both of the patients will present with intense fear of weight gain. They are preoccupied with their body size and body image. They refuse to eat out. Amenorrhea could be one of the presenting symptoms. And in binge and purging type, they use laxatives or diuretics or they induce vomiting to control weight. In terms of differential diagnosis, major depressive disorder or body dysmorphic disorder or other endocrine abnormalities should be considered, like hyperthyroidism. Bulimia nervosa is only differentiated with close to ideal body weight, but they always think that they are too fat. They have distorted body image, and this is almost same clinical presentation as anorexia nervosa. And differential diagnosis, major depression, borderline personality disorder. In both of these conditions, they are not in compulsion to lose weight. In terms of medical complication, binge eating can cause gastric dilation or gastric rupture and can eventually even lead to obesity. Vomiting can cause esophageal rupture, loss of potassium, hypochloremic metabolic alkalosis, and inflammation of the parotid gland. Laxative can cause constipation, and diuretic use can lead to electrolyte abnormalities, which can lead to cardiac arrhythmias. Starvation, you can get anemia, hypotension, hypothermia, hypercholesterolemia, edema, and even dry skin and lacuna hair. In terms of treatment and management, usually the drug of choice is SSRIs, and if they are really severe, then you should initially start with electrolyte correction and also feed them by using feeding tube. And psychotherapy, it's mainly focused on establishing their self-esteem. That concludes my presentation. Thank you.